Dave.
Good afternoon, everybody. Today's announcement is the unfortunate, inevitable consequence of inaction. We had hoped that this day would not come where we had to be in a position where we felt it our obligation to notify any recipient of Medicaid of the possibility, and at this point it is a possibility, that their Medicaid benefits would cease. We have waited as long as we possibly could to be able to deliver this news, but we feel obligated to notify those individuals who are on eligibility programs that they may no longer be eligible as a result of the fact that those programs are presently not funded in the budget that left the House of Representatives. Now, I know there have been questions about why we're doing this and the timing of doing this, and I want to address that briefly to let you know this is something we have been considering for quite a while and we've talked about for quite a while. We've talked about over the course of the past year the ultimate consequences of not fixing the budget shortfall as early as possible. We had an opportunity to do that last year in the regular session. The governor created another opportunity for the legislature to act in the special session earlier this year, and despite those two opportunities, no revenue measure ever left the House of Representatives. And during that entire time, we have heard from individuals saying, we'll cut our way out of this budget. That's the end result. We don't need to raise revenue. We're going to cut our way out of the budget. We now see what those cuts look like. The budget that left the House of Representatives, as we all know, has eviscerated the Medicaid program. It has left gaping holes in other areas of the budget. It has failed to fund our partner hospitals in a way that is going to has necessitated many of them giving us notice that they will no longer be our partner if they don't receive funding. So we have reached that crisis point, that flash point, where if we are not going to solve the revenue problem, we're going to be forced to deal with the cuts that may be included in the budget that ultimately leaves the legislature. But we know what the House has said. This is the budget that the House has delivered, saying this was an acceptable product based upon the revenue that was available. So the cuts that have been imposed based upon an apparent belief that we can cut our way out of this revenue problem has resulted in the non-funding of our partner hospitals and the failure to fund any number of Medicaid programs, including those that we addressed today. Now, the programs that this one-page notice that is going out address, Rebecca will get into in more detail, but there are 4 eligibility programs, and this is what's important to remember about the reason why these notices are going out. The individuals receiving the notice, that number about 37,000, are being told that they may not be eligible for Medicaid services. The federal government requires states to make a redetermination of the eligibility of those individuals to see if they may be eligible for some other type of program that would keep them on the Medicaid rolls. That process has to begin, and it has to begin now as we face the beginning of the new fiscal year. Those are the only individuals, I put quotes around only because 37,000 is an awful lot, but it is not the entire 1 million or so Medicaid population in the state. And I recognize that the difficulty that this is imposing upon recipients, we understand that. We don't want to have to be doing this, obviously, and we've waited as long as we possibly could to do this. But because the rulemaking process has begun and emergency rules are in place, and because inquiries are going to begin to be made of individuals as to what other eligibility they may have, we feel that it's appropriate and necessary to forewarn these recipients of what may be coming. And you'll see when you read the one-page notice that there's no politics involved in it. It's not saying call your legislator. It's saying call the Department of Health and let us help you. And it's advising them of what may take place as we barrel toward the cliff. And it's our sincere hope, as all of you know, that the cliff is going to be resolved in a way that is responsible and that raises the revenue necessary to not have to impose these terrible cuts on the people of Louisiana. And I'm hopeful as we stand here today, having read news reports, some conflicting and otherwise, that we may be ending this regular session early, perhaps as early as the 18th which allows the governor to call the special session immediately thereafter so that the legislature can go about the business of addressing the revenue shortfall and coupling that with an expenditure budget that does not impose these type of terrible consequences on the people of Louisiana. So Rebecca is going to review in more detail exactly what the letter does and the steps that the department's taking to try and ease the concerns as best we can of the people who are being affected.
Thank you, Commissioner. Today is a really unfortunate, disappointing, and unprecedented day. This is disappointing for those of us. I'm a healthcare provider. I took the job as Secretary of Health as the governor directed me to expand Medicaid and to expand access to health care for an unprecedented number of Louisianians. We have, through the Medicaid expansion, created nearly full coverage for the state and a new day for health care. This notice is exactly the opposite of what we came into these jobs to do. Michelle and myself, the leadership at LDH, our hearts are breaking over the need to do this. However, we cannot provide services with no money to pay for them. We simply cannot. And as the commissioner mentioned, the legislature has had multiple opportunities to address this problem and has not made that choice, and in fact has sent to us massive cuts. And of course, these are the cuts that we're addressing in our letter tomorrow, but also on the cut list are our medical schools, our safety net hospitals, and services for over 100,000 other people. The reason we are doing this is because the budget cut is so substantial, $1.8 billion to my department, that we simply cannot function as we did before with this budget, and we need to take action so that we don't need to have additional mid-year cuts. So what we're doing, it follows federal and state policy. When we make changes to services and limit them, we need to change our policy, send it into the federal government. They have to approve it. We have to give notice to providers and to clients. These individuals need what's called a redetermination, so we're giving them as much time as possible so that they can find out whether they're eligible for another type of Medicaid that will allow them to continue to have the service that they're receiving. It would be unfair in the wake of all of the inaction to wait any longer. We need people to have a chance to see what other options they have and what they will need to do to make plans. We hope this will not happen. We have faith that we will come to an agreement and solve this problem, but now we have to act to be able to make the $1.8 billion of cuts that are in the House's budget. I'm going to let Michelle explain to you exactly the process. This announcement is about giving people information. We are available to you. We're allowing our folks to work extra hours. We're adding information to our website. In our letter, you will be getting information as to what you need to do. But this is an opportunity for us to communicate with you, and today's opportunity to talk to the press and the public about what they can do in the wake of these cuts. I'll let Michelle speak further about the specific notices and actions.
Good afternoon. I would like to describe what these eligibility programs are that are being that individuals are currently in and for whom they will receive notice that they may be eliminated in the coming months. As Secretary Gee said, the letters will be mailed out. These are snail mail, hard copy letters that will go out in one batch tomorrow to just about 37,000 currently enrolled Medicaid recipients. And we will begin a process of promulgating rules and regulations to affect the elimination of these programs along with other Medicaid services that the Secretary mentioned. As part of that process, public notice is required. And so in addition to what the Commissioner noted, which is the letter will ask the recipients to stay tuned for additional information, let us know what their current income and status is, and also apply for Social Security income, SSI, if they haven't already done so. So it's both an informational letter as well as an ask for recipients to help us enroll them in other Medicaid programs if possible. The 4 groups that are going to be eliminated are the Provisional Medicaid group. This group is for individuals who are age 65 or older and disabled. These people have very little income, below $750 a month. This accounts of the 37,000 for 7,000 of those individuals. The second two programs are both medically needy programs. These programs allow Medicaid coverage for individuals who have extraordinary health expenses that exceed their income per month. And we have just about 1,200 people. Many of those folks are currently residing in nursing facilities and in intermediate care facilities for individuals with developmental disabilities, otherwise known as community homes. The fourth and the largest group, which you have heard a lot about as we've gone through the appropriations process, is the long-term care special income level group. In order to be in this eligibility program, an individual has to make between $750 and $2,250 a month or less, and also is aged and blind and disabled. Lastly, these individuals have to meet what we call institutional level of care, which means that they meet federal standards for not being able to care for themselves and are either in need of home and community-based support or reside in a nursing facility or a community home. This accounts for 17,000 people that are currently residing in nursing facilities, 2,600 people in those group homes for individuals with developmental disabilities, 7,000 people receiving either an aging or developmental disability waiver through the health department, and hundreds of people that are in other community-based programs such as PACE, which is in New Orleans, and Lafayette and Baton Rouge. This income group accounts for the majority of the 37,000, again, and really is going to deeply impact many individuals, including those at our own state-run facilities, Pinecrest and Villa. And as the Secretary mentioned, lastly, we will be promulgating rules, and you will also see those in public notice, to eliminate further services to everyone in the Medicaid program. That's over the 1 million people that we cover currently. That includes the Pediatric Day Healthcare Program, Community Psychiatric Support and Treatment, Psychosocial Rehab, those are 2 mental health programs for adults, outpatient drug and alcohol treatment for individuals in our state with substance use disorder, along with ambulatory surgery services. And again, I echo the Commissioner and Secretary Gee's sentiments that this is a painful thing for us to have to do. We've been able and been very fortunate to expand services and expand the quality and improve the quality of the services that we provide, and this is really going in the opposite direction. And so we do hope that people that get this letter, those individuals and those families will be able to work with us. We will try very hard to find other placement, other eligibility that is possible. We've also notified social service organizations across our state so that they are aware that they may be seeing an increased excess into their services for housing and other social supports. And we were happy to take any questions.
Thank you. Before you, let me make 2 other points before we take your questions. The first is, and I think you know this, but it's important to note, these 4 programs that have been cited are several of the many optional programs under Medicaid. Medicaid is an entitlement program, and the federal government says if you are eligible for Medicaid, you must receive certain services. It also allows states to provide optional services. All of these are those optional services, which is why they become so vulnerable, because we don't have to do them in order to maintain our status as a Medicaid provider. And secondly, I think, as all of you know, there's about $1.4 billion in revenue rolling off the books as a result of these taxes going away. The governor's ask after the recent revenue estimating conference has been, and again I put quotes around this, $648 million is what we need to fill this gap in order to try and fund the things that are on the chopping block right now, which is why it's so important that we get to the special session, have an opportunity to discuss the need for that revenue in the context of the way the legislature is saying it wants to spend the dollars that are available. So, questions?
Yes.
Right.
Are you required specifically by law to send these notices out right now?
No, there's no federal requirement for a specific date to send these letters out. These letters are being done because this eligibility is being redetermined, and we have to start the process, and that emergency rule process has begun, and so that process is underway. It's important to let the people who are adversely affected by this potentiality to also be notified so they can start looking at possible alternative plans or coming forward and saying, I may not be eligible under this program, but this is my situation, where am I eligible? Yes.
So
we would not be able to help the largest group, which is the special income group that Michelle mentioned, that requires $263 million in order to be fully funded. It is an all-or-nothing program.
So you
If-
need,
For that program, we need $263 million.
$260 million,
That-
even getting $200 million is not helpful.
That's correct.
So not, I thought originally it was like 230, but the total
Yeah, I
needed
thought it was
is 280, is that what?
No, it's 260, and it's 263.
263?
If you add them all up, it's a, I don't remember the exact number of adding them all up. Do you have the number of, that's the big dollar one, is the $263 million
So
one.
why is it 263 million now? Because Greg's right, I've been hearing 230 for a few months. It just-
Can you explain?
It's $231 million of state general fund. We also need an additional $29 million in statutory dedication, so it's really just a means of finance difference.
Okay, thanks.
The entire whole with total means of finance is nearly $1 billion if you include the federal revenue.
So what kind of reaction do you think there's lawmakers think, many of them think that you should send these letters, but they almost all agree that it would cause some kind of a, great alarm or even panic. What do you think the reaction will be?
I would imagine there's going to be an extreme adverse reaction to anybody who gets this letter, and I don't blame them. But the letter is couched in terms, of very careful terms when you read it, of telling the individuals this may happen. It's not saying it's definitely going to happen. It tells that it's subject to what may happen in the future, that CMS must approve any change that takes them off of the program. It invites them to come forward and see how we may help them, how the department may help them. But I agree that it is going to be alarming to people to get these letters. That's why we don't want to have to send them, but we have to do so. It's the responsible thing to do at this point in time. If you remember back in 2016, the legislature came into special session in February, just like the governor called them in February of this year. And it was then, in February of that year, that the legislature imposed the temporary taxes. So there was a ramp-up time to deal with the budget shortfall and was not an immediate threat to this program. In fact, this is the first time ever that these eligibility-type programs have ever been placed on the chopping block. And the only reason they are is because of the magnitude of the cuts and the fact that they're optional and there's no place else for the department to go. And you've heard us say before, when you look at the state general fund and the revenue that is rolling off the books, and you look at how that state general fund dollar is spent, it's spent on education and health care to the tune of about 85% of the entire dollar. This is where the money is, therefore this is where the cuts have to be imposed if the revenue is not generated by the legislature.
And let me just add that the department has always provided a list to the legislature in priority order of what would happen as a result of these cuts. When we say optional, what we're talking about is in 1965 when Medicaid was enacted, what was not required for states and what continues to not be required for states. Our other options are awful too. Adult pharmacy, no medications at all for adults. Dialysis, hospice. But because this is such a large cut, $1.8 billion with federal funds, so I want to underscore that the cut in state general fund leads to a massive hit to healthcare, much larger than the state general fund impact. These are our other options. None of them are good, and the legislature knew what those were when they decided to appropriate the monies that we have. And so we have to make decisions based on those monies. And what we're doing is allowing people as much time as possible to plan. And when we have to publish to meet these July rules, we have to publish rules, we have to give notice. Yesterday in the Register, we gave notice. That becomes a public process. And so this is a proactive way of communicating with the public. And this is for the patients. This is for the clients. This letter is for them so that they understand where they can go, what numbers they can call, and how they can get help to work through this.
Question?
Chris?
Okay, so the sample letter says the federal government must first approve the ending of the programs. If the money's not shored up, and then there's no money to run these programs, but the federal government doesn't support the end or approve the end of it, then what happens?
Well, that's the predicament. If the money is not there in the budget to do it, but we have to continue to maintain the programs until the feds say you can stop them, then we're going in the hole, spending money that is not appropriated for that particular purpose. And
Then is this letter a scare tactic?
no, this letter is scary, but it's not a tactic. I mean, this is the reality that we're facing, and the legislature is not going to be able to simply say, unless they put it in the budget, we're going to fund this program for 2 months or 3 months. and then if they put in the budget and then it's over. The same consequence would happen there if they want to direct money for some limited period of time. That would not be a balanced budget for the entire year.
So again, just so that I heard you correctly, if the feds don't give you guys the green light to shut down this program, then the state will just have to fund it and then just, what, take out the loan or
We'll go to something else on the list. I mean, we'll move to the things Rebecca mentioned. We're not cutting hospice, we're not cutting adult pharmacy, we're not ending the now waivers. We're not doing any of that. But if these don't get approved by the feds, we'll have to look elsewhere if the legislature doesn't provide the money in the Medicaid budget. So it is an unfortunate domino that continues to fall until you get to the point where the feds would say, you can cut something. We hope we don't get to this point. We hope within the next 30 days or so, the legislature is going to pass a budget that's going to provide this funding. That's what we're counting on, and that's what we're hoping for.
And I want to reinforce the fact that Medicaid is a state and federal partnership. In our case, the feds fund most of our program. There's nothing that we do in the Medicaid program that's not in a state plan with the federal government. So this is part of any process. When we make a change, we have to have federal approval. So this is, not unusual that we have to put something in front of CMS and get their approval. It's not, this is just how it works when we do things.
And then we would be deficit spending. We'd basically be spending money that's not been authorized, which means later in the year, we're going to have a mid-year cut to something that is funded because we had to do this until we got CMS approval. So you can see how the consequences impact other areas of the budget as well and create the problems down the road if we are going right into a mid-year deficit as soon as we start the fiscal year. Yes?
So is this, if you all get more money from the governor's or the administration's perspective, is this the top priority in terms of what gets money? Is this over hospitals and TOPS and prisoner housing and other things that are not funded right now?
I think we've said pretty clearly that how do we pick between all of our children and make this Sophie's choice between keeping our hospitals open, providing medical education, giving people an opportunity to receive primary care service, or taking advantage of one of these waiver programs, or having TOPS fully funded, or making sure sheriffs don't return thousands of state prisoners to state custody for which we would have to be responsible and for which we have no money. All these things are impacted. What we're talking about today is the biggest and the most glaring example of the problems created by inaction, but we can spend time talking about no funding for the sheriffs, keeping state inmates. We can talk about the assistant DAs potentially not be funding. If some of the chatter that is taking place in the Senate happens over the next few days, there's a possibility that they'll seek to fully fund Medicaid and fully fund TOPS and then just cut government as we know it. There's no other place to go, as I've been saying repeatedly, and I don't know what that would serve, because then you wouldn't have the rest of state government literally to operate or to have employees to take care of the needs of government. Those are the only kind of options that are out there because there are no good choices.
I know there are no good choices, but I'm asking, what is the administration's top priority for getting extra money that's not currently funded?
Right now, we want to get $648 million and make sure we fund everything. We've stated pretty clearly in the past that the funding for hospitals and for individuals on Medicaid and TOPS are all top priorities for the governor, and we'll continue to have the discussion about how we may allocate resources if the legislature is unwilling to provide enough funding for all three of those priorities and other priorities.
So you're not ready to say right now that these people are the top priority for getting money if there's only partial amounts of money added back?
I'm not, and I'll tell you why. Because I don't want to close our medical training for individuals and have us pay for doctors in Louisiana to go get educated elsewhere where they're likely to stay. I don't want to tell you that it's more important than keeping our partner hospitals open so that we can continue to provide that care. I don't want to gauge what's number one, number two, or number three because they're all important. And we'll have to make a very difficult decision, or actually the legislature will, when it decides where it wants to allocate the dollars that it may vote to fund.
So Commissioner, there's a portion, or Secretary, there's a portion of this population that will get these letters who certainly won't have the ability to even read it or to open. How are you going to address that as you move forward?
Yes, we are very well aware of that, and in fact already had a conversation with our families at Pinecrest, which is our largest community home for people with developmental disabilities, so are very well aware of the types of questions that families have on behalf of their siblings, son, daughter, that will be getting this letter. All day yesterday we had conversations with provider groups So nursing facilities, those support coordinators that go into the home for people that are on our aging waiver who will lose the service. And then today we've had continued conversations with the developmental disability community, knowing that the largest portion of these people, in fact, are just the people you're talking about, who may or may not have a family member who can get this letter with them and explain what it means. So we're proactively reaching out to those provider groups to provide them with frequently asked questions, explanations, answering all their questions and answers so that they can be better prepared to talk to individuals. And we've also extended the hours of our call center so that the individuals who do get the letter and have questions, or their family members, can call us into the evening hours if they have additional questions that those providers can't answer.
Yes, ma'am, but similarly, how many people have you added to this call center, and what do you expect the wait time will be for those people who have questions?
We've extended the hours. We are prepared to continue to extend as we monitor. We haven't had to add additional staff, but it's something that's very easy to flex up in terms of additional hours or additional staff if needed.
And about how many people is that, ma'am? I'm sorry.
How many people work in our call center?
We can get that for you.
We'll get that for you. The staff are in the back.
I know that part of the point of sending out these letters is to see if people might qualify for other programs. I guess at this point, do you have any sort of ballpark how many people might be able to fit in somewhere else?
It really is very dependent on the individual and family assets, income, and circumstance. As I explained earlier, these 4 eligibility groups, each one has a very detailed explanation as to why these people are made eligible. And it's a combination of their medical expenses and their income and assets. It's also taken into account what their ability is to live on their own. So people that meet institutional level of care and can't live on their own may have better access or eligibility through our Medicaid programs in the way that we have it structured. So we don't know exactly how many people, though of course we have looked into that. We're not incredibly optimistic that the majority of these people will have another option, particularly for funding their long-term care needs, which are very expensive. But we're overturning every rock and looking at every possible alternative, even if it is to get some of these individuals who, through these particular eligibility categories, not only have their long-term care covered, but their hospital visits, their pharmacy co-pays are covered. So if we can get any of these individuals to qualify for any part of our basic Medicaid program that might cover some of those services, we're trying very hard to do that.
So you'd be able to afford that? I mean, that would be pushing them into a different, would that not cost more money?
Depends on the category. So for example, if some of these people would qualify for the expansion group and they can get some minimal primary care benefit, we don't see a huge dollar amount added.
So bouncing off on Elizabeth McGurk's question here, do you have any sort of timeline of how long it would take to figure out the other options? Do we see this going up right to the June 30th deadline, or what do you see?
The redetermination process really it's a partnership between us and the individual. So when we talk to people at Pinecrest, some of those families, when they got this, when they understood what the special long-term care eligibility coverage meant, some of them had to go and get documents. They had to ask other family members for questions about their individual's family members' Social Security income. Some of them are employed, and so they're going to have to maybe ask their employer some questions. Some people with developmental disabilities or aging that are working out in our community. So we really do have to take every individual step by step, and that's why we have this call center extended to do that. So it could be as much as one conversation, but we're prepared for it to be several conversations.
I want a little more clarity. I know that if they get pushed, for example, into the expansion category, if you will, that their services will not cover staying in a nursing home or being in a group home. Are people who might end up in another category of Medicaid likely to get some sort of care that's adequate to, I don't know if you can answer this, but adequate to what they're getting now?
It is unlikely that any of the other categories, with the exception of people who, for whatever their own personal reasons are, haven't yet applied and gone through the process of SSI. Medicaid federal requirements. If you qualify for SSI, you immediately get Medicaid coverage. So we are absolutely encouraging individuals. You'll see that in the letter. If you have a pending application that needs additional information sent to the feds, if you haven't yet applied, we know for a fact there are some individuals that haven't, please do go and apply. Because in those cases, we may be able to get them into another long-term care program. But for the vast majority of these people, this is their long-term care program.
I gotcha. I'm only asking that question because I think a lot of people, I didn't know until about a year ago, don't realize that like there are different types, like if you're in the expansion population, you're not eligible to go into a nursing home or receive home health care services.
You're right, and in fact, that's what we're finding with some of these preliminary conversations with families. And that is one of the most important reasons why we want to get this information ahead of them and start having these individual conversations.
So I'm sorry, but is the call center and these extended hours available immediately because the media reports will go out before the letters even get there? And I want to make sure that.
Yes, the call center hours are available immediately, and we're monitoring it very closely so that if we have to extend those, we will absolutely do that. And in addition, we've also offered to some of our major providers, if they need individual calls with the residents in their facilities, we will also offer to do that.
One last question. Okay, as far as the emotional toll here, I mean, I would imagine Aaliyah is expecting to get so many calls from people frantic at this point. Is there a way to prepare emotionally for just hearing all these stories and just moving forward from there?
I don't know that you certainly can't prepare the recipients to get a notice like this coming in the mail, and frankly, I don't know that you can prepare these employees who live this every day and care for these people, are concerned about these people, and didn't want to have to do this, but recognize that we had an obligation to do this in terms of the situation that we're in. And I think it's going to be very difficult on everybody, and unfortunately, this should not come as a surprise to anybody. We've been talking about this when we introduced the budget. We said this is not the budget we want. These are some of the consequences of not funding things. As we talked through the budget process, we provided a schedule, a time frame of when these notices would begin, when this process would have to begin. We even pushed that back, really in my behest, several days into May to try and figure out if there was any other alternative, and we concluded that there's not. This process must begin given the situation that we're in, and that therefore obligates us to have to notify people that they may be adversely impacted.
Well, and we've really tried to underscore that these are real people. These are, we've told the stories, and it's just an action. So unfortunately, we have to act, and it's not easy. It's not easy. I mean, Michelle oversees the facilities. We see these people. We meet with them and the families. It is not. This is not something we want to do, but we think it's important to have as much information as possible. I mean, being a caregiver, being someone who needed services myself. I mean, it's fair. It's only fair to them to let them know so they can prepare and have the best information they can and as much notice as they can so that they can make their plans. But this is not how, as I said, we are all about expanding care. That was the governor's first day in office. It was about expanding care, changing this health system so that we went from patches of care to a patchwork quilt covering the state. It's the thing that I'm most proud of. And this is absolutely not, this is not the heart of this administration to do this. This is not where we want to be. But we think it's fair, and we think it's the necessary thing.
All right, thank y'all.